Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Metformin tablets, exploring the various aspects of metformin, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of metformin tablets. Metformin is a medication commonly used to manage type 2 diabetes mellitus. It helps to control blood sugar levels and is often prescribed when diet and exercise alone are insufficient to control blood sugar. Metformin can be used as monotherapy or in combination with other medications, including insulin. It is also sometimes used for conditions like polycystic ovary syndrome and prediabetes. Next, dosage of metformin tablets. The dosage of metformin varies depending on the patient's condition, response to treatment, and the form of metformin used. Let's discuss the general dosing regimens. The starting dose is usually 500 mg twice daily or 850 mg once daily, taken with meals. The dose may be gradually increased by 500 mg weekly or 850 mg every 2 weeks, up to a maximum of 2,000 to 2,550 mg per day, divided into 2 or 3 doses. It is important to follow the dosing instructions provided by a healthcare professional to minimize the risk of side effects and optimize blood sugar control. Next, mechanism of action of metformin tablets. Metformin works primarily by reducing hepatic glucose production and improving insulin sensitivity. It does this through several mechanisms: inhibition of gluconeogenesis. Metformin decreases the production of glucose in the liver by inhibiting mitochondrial glycerophosphate dehydrogenase. Increased peripheral glucose uptake. It enhances insulin sensitivity in muscle tissues, leading to increased glucose uptake and utilization. Decreased intestinal absorption of glucose. Metformin reduces the amount of glucose absorbed from the intestines. These actions collectively result in lower blood glucose levels, particularly fasting glucose levels, without causing significant hypoglycemia when used alone. Next, side effects of metformin tablets. Metformin is generally well tolerated, but it can cause side effects in some individuals. Common side effects include gastrointestinal issues like nausea, vomiting, diarrhea, abdominal pain, and loss of appetite. Taste disturbance like a metallic taste in the mouth. A rare but serious side effect characterized by the buildup of lactic acid in the blood. Symptoms include muscle pain, difficulty breathing, stomach pain, dizziness, and feeling cold. To minimize gastrointestinal side effects, metformin should be taken with meals, and the dose should be gradually increased. Next, important advice for using metformin tablets. Metformin should be taken with meals to reduce gastrointestinal side effects. Adhere to the dosage prescribed by your healthcare provider and do not adjust the dose without consulting them. Regularly check your blood sugar levels as instructed by your healthcare provider. Drink plenty of fluids to help your kidneys function properly, especially if you experience diarrhea or vomiting. Metformin can interact with other medications, so inform your healthcare provider about all the drugs you are taking, including over-the-counter medicines and supplements. Know the symptoms of lactic acidosis and seek immediate medical attention if you experience any. Attend regular appointments with your healthcare provider to monitor your condition and adjust the treatment as necessary. Alcohol can increase the risk of lactic acidosis, so limit alcohol consumption while taking metformin. By following these guidelines, patients can effectively manage their condition and minimize the risks associated with metformin therapy. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using metformin tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.